Hello, I'm going to explain to you about your coronavirus or COVID-19 vaccination to help you understand what to expect. You might also hear people referring to this as the coronavirus jab. The government has agreed that everyone over the age of 16 on the GP's Learning Disability Register is entitled to the coronavirus vaccine. You should have already received your invitation, so if you haven't, please contact your GP surgery to check that you are on their Learning Disability Register and ask to make an appointment for your vaccination. There are a few different ways that you might be invited to your vaccination. You might get a text or phone call from your GP surgery or a letter from the NHS. However you are contacted, please remember that you are entitled to your coronavirus vaccine for free. So if anybody contacts you claiming to be from a vaccination centre asking for your bank details, this will be a scam. Do not respond and do not give them your bank details. The coronavirus vaccination is an injection that you will be given in your arm. Everybody needs 2 vaccinations to make sure that they are fully protected from coronavirus. The coronavirus vaccine is completely safe. It helps your body to produce antibodies that will fight off a COVID-19 infection. When you go for your vaccination, it's a good idea to wear short sleeves as the injection is given in your upper arm. Before you're vaccinated, the nurse will ask you a few questions to make sure that you're well enough to receive your jab. You will also be asked to sign to show that you agree to having the vaccine. If you have any questions or worries, please ask your nurse, who will be happy to answer your concerns. Don't worry about thinking that your questions are too small or silly. I can assure you the staff will not be annoyed by you. When you have your vaccine, you will feel a small scratch on your arm, and then the nurse will tape on a piece of cotton wool, which you'll be able to remove once you get home. Depending on which type of vaccination you have, you may be asked to sit and wait for 15 minutes afterwards just to check that you're okay before being allowed to leave. For a few days afterwards, you might have a stiff or sore arm or feel a little bit poorly. This is completely normal. Just make sure that you rest and have enough food and drink. If you are worried, then contact your GP or call NHS 111. About 12 weeks after receiving your first coronavirus vaccination, you will be invited to have a second jab. It's very important that you also have this injection. Don't forget that your coronavirus vaccination is different to your flu jab, so make sure that your GP offers you this one as well. Once you have been given the coronavirus vaccine, you will be protected from getting seriously ill from a COVID-19 infection. However, it doesn't guarantee that you will not get the infection or that you can't pass it on to other people. So it's very important that you still follow government guidelines, making sure to wash your hands regularly, keeping your distance when you're out and about, and if you are able to, wearing your mask.